Hello.
Hi.
Thank you for coming in today.
Yeah.
How are you doing today?
I'm good. How are you?
Good. Well, today is November 18th, 2020. This patient's ID number is 4482. She is a 22-year-old female. What is your chief concern today? What brings you in?
Just for my regular cleaning.
Okay. And the patient also came in today for nutritional counseling because she did a 5-day diet recording analysis. I just want to thank you for recording your diet for 5 days. It can be a lot sometimes.
Yeah.
So after looking at the patient's medical history, this patient is taking medication for ADD and anxiety, which causes xerostomia. And that would just be something that we would want to address to this patient after looking at her diet as well, and relate how xerostomia can cause cavities if not taken care of correctly. Her dental and social history looked within normal, was good. Her assessment of her extraoral and intraoral, there was a couple suspects on numbers 3 and 14 that we would want to note. This will be why we did our dietary analysis today, because we want to look at how much sugar they are intaking during the week, and with her dry mouth, we want to see how that relates together. Do you have any questions so far?
I don't think so.
All right. So when we did our assessment, our caries class, when we asked you those questions about if you have fluoride in your water, when's the last time you had a cavity, and since you did have xerostomia, that automatically puts you at the high risk with those suspect cavities, okay?
Okay.
And your plaque index today was 16%, which is pretty good overall. We want it to be less than 5%, 10%. But we want it was overall pretty well. I mean, you didn't have much buildup in there, which is good. So, after looking at your analysis here, so I have your sugars are in orange and your carbs are in pink here. And what we want, so you had some waffles frequently is that like a normal thing that you have every morning?
Yeah, I pretty much eat waffles every morning.
Okay. And it looks like they're the wheat waffles, or do you have the regular waffles?
I usually eat the wheat waffles.
Okay. All right, so that's good because the white waffles probably have more sugar in them than the wheat do. And that, if there's carbs, typically there's, higher amounts of sugar. And I'll get into how that breaks down and how it relates to your oral health later. On November 11th, waffles again for breakfast. And it looks like you had some Chinese food that day.
I did.
So that is high in carbs, which is what we would want to be cautious about.
Mm-hmm.
And then your Red Bull. It looks like you have Red Bull. Do you have Red Bull a lot?
I would say probably like once a week.
Okay. And that's okay. As long as you isn't every day, it's not all the time. When you drink that Red Bull, are you sipping on it for a long time, or are you just having it like in one sitting, just drinking it?
I would say probably in the span of an hour, I kind of sip on it.
Okay. All right. So we will talk about the importance of not having it over 3 hours or 4 hours. But that's good that you just kind of just sit down and drink it when you need it. Moving on here. You went to Caribou Coffee one day. I see that.
I did.
'Tis the season, right? For
It
the
is,
good coffees. Just one thing to be kind of mindful about. I mean, it's not like it's an everyday thing. But there is a lot of carbs and sugar in those Caribou Coffee drinks. So you just want to be aware of that because that can lead to, breaking down the sugars in your mouth, and we'll talk about that. And then Taco Bell, the Baja Blast, so it had 74 grams of carbs.
Oh, wow.
And 74 grams of sugars.
Oh, no.
Which is a lot.
Yeah.
But you don't have it every day.
No.
And it's a once in a while thing, which is okay.
Mm-hmm.
And those types of foods are okay if they're not happening all the time. Okay? But maybe just get a small instead of like a large. You know what I mean?
Yeah.
And then you had waffles again, which are high in carbs. Some Chipotle bowl, which you had one day, which was a veggie. So you had the carbs in there, and 17 grams of protein. So it kind of balances out because you had a lot of protein probably within that as well. And then your pizza has lots of carbs and fat in there. So that was their 4th day. And then your last day, you had another caribou coffee and a bagel. And then you went to Jimmy John's. So the last day that you recorded, there was a lot. That was one of your higher days of your carb intakes. Because you started off with your coffee and your bagel. And then, which is like 130 grams of carbs right there.
Yeah.
And then for lunch, you had Jimmy John's.
Yes.
Another carb sandwich, which is okay. Like, this is okay.
Yeah.
And then vegetable fried rice, Chinese for supper.
Yeah.
That's okay. Just the importance that I'm bringing these up is because all the carbs that you consume have sugars in them. And the sugars stay in your mouth and they break down your tooth surface.
I didn't know that.
Okay?
Okay.
So I have my flip chart here. And with this here, it talks about your 4 areas that can lead to a cavity, okay?
Okay.
So we want to have the microorganisms, which is the bacteria that causes cavities. So the streptococci and lactobacilli, those is just what you already have in your mouth. There's nothing you can really do. If you've already had cavities before, they're just automatically going to be in there.
Okay.
So then you have your cariogenic diet. So this is what we were just talking about, your carbs and your sugars that you're intaking throughout the day. Foods that are high in starch, sticky, and sugary. So for instance, your like caribou drink that you had 2 days out of the 5 days, that's high in sugar. And your pizza slices or your bagel have high carbs. Those carbs contain sucrose, glucose, and fructose, which break down your tooth surface because saliva factors go into part of this. And because you do have dry mouth from your medications, this is why it's so important for us to try and limit some of these.
Okay.
Or just make sure we keep up on your oral hygiene, because when those 3 factors are at play, then all you need is a tooth that is susceptible to it, and basically then the sugars just attach to the tooth and eat it away.
Okay.
So then, in this picture here, so the sugar from the carbohydrates creates the bacteria, the streptococci or lactobacilli, which then forms the acid, and the acid goes onto your healthy tooth, which then creates decay or your cavity.
Oh. Huh.
Do you have any questions about that process at all?
No, I think that actually makes sense, yeah.
So, especially for you, I mean, is there anything that you would want to change based off of what we've been talking about?
I probably want to change not eating out so much. I feel like I eat out a lot, and those foods often come with having a lot of carbs and stuff. So definitely incorporating more veggies and fruits, more healthy foods into my diet.
Yeah, I would agree. And what come with veggie and fruits comes with different vitamins too that we want to have in our diet, which can kind of brings me into my next topic too, about your periodontal disease risk and where you are at. But before I get into that, how often are you snacking throughout the day when you snack?
It really depends on the day. My more busier days, I feel like I don't snack as much because I'm busy and I don't have the time. But on the weekends, I feel like I snack more in between, kind of just out of boredom, and just grab food and drinks and just snack.
Okay, so the importance of that is how I told you about the sugar and bacteria. So the more frequent that you're snacking throughout the day, those sugars, the saliva in your mouth never gets a chance to break down those sugars. The sugars just keep getting added and added. So the tooth and the mouth never has an ability to get down to its normal again.
Okay.
So that's why, like, when you drink your Red Bull or you drink your Diet Coke that you have, just drink it in one sitting instead of sip on it for multiple hours. Does that make sense?
Yeah.
Okay.
Yeah.
All right. So a couple things that we can help keep, your carbs under control and how to deal with it. Not saying you need to cut carbs completely out of your diet because you don't have to do that. But rinsing with water. So after you have a lot of sugar throughout the day, so for instance, your caribou drink, that if you don't want to brush for at least 30 minutes after that because the sugars in your mouth will make your tooth soft, and you don't want to brush for at least 30 minutes after that drink, and then you want to brush and floss for sure before bed for 2 minutes. You don't want to have too many snacks throughout the day that have high sugars, so more fruits and vegetables like you said. Fruit is good, but it is high in sugar, so just kind of be aware of that. But it is going to be better than like a Twix bar or Hershey's candy bar or something like that, okay?
Okay.
So since you do have dry mouth, I do recommend sugar-free gum that has xylitol in it. Do you like chewing gum at all?
I do, yeah.
Okay. So with the sugar-free gum, I know Orbit is a really good one. They have xylitol in the first ingredient, but when you look at the package, it'll have the first 3 ingredients, and you want it to have xylitol. It's spelled with an X, xylitol. You want to have that within the first 3 ingredients on the gum, okay?
Okay.
And then have you ever tried like a Biotin rinse or any tablets for your dry mouth?
I haven't.
Okay. How bad is it? Like, do you notice it more when you're working? Do you notice it more when you're at home? When you're sleeping at night?
Mainly notice it at night
Okay.
when I'm sleeping, yeah.
Okay. So there is some Biotin tablets or mouth rinses that we can look into for you if you're interested.
Okay. Yeah.
And then just try not to eat any high sugar foods before you go to bed.
Okay.
Because with that dry mouth, your saliva isn't in there breaking down those sugars, and then it just sits in that dark place all night long. Does that make sense?
It does, yeah.
Okay. So lastly, on to your periodontal class here. You were healthy. You didn't have any bone loss. Stage 1, grade A is what that means to us. So I can pull that up here. So the reason that we want to have a healthy mouth is because when you're healthy here, your pockets are low, and then when you brush and floss, you take out the sugars and whatever's in this pocket here when you're flossing, so that it doesn't create a cavity in this area, okay?
Okay.
When there's cavity and buildup here, it can lead for the bone to go down, which is what causes the periodontal disease, okay?
Okay.
So how does your diet relate to periodontal disease? Well, there's different vitamins that are beneficial to your mouth that can help keep your bone nice and strong, okay? So
Okay.
for instance, vitamin C helps your tissues, it helps prevent gingivitis, it strengthens your tissue in your mouth, so your gums, okay?
Okay.
Fruits have vitamin C. They're really high in vitamin C. Otherwise, they do have the vitamin C packets. Have you ever seen those before where you can like mix them with water?
Yeah, I love those. Yeah.
You could do those to get your vitamin C in for the day.
Okay.
Vitamin A also helps keep the mucous membranes healthy. So mucous membranes is what you are slacking with your dry mouth. So this is where a vitamin A, vegetables, fish, like any green vegetables, you could get at least 1 serving of those in a day would be beneficial just because you do have dry mouth, you know?
Okay.
Do you like fish or tuna or anything like that?
I'm not a fan of fish or tuna.
Okay, what about vegetables?
I do, yeah. I enjoy
Okay.
vegetables.
Vitamin D is to help absorb calcium to boost bone mineral density, which is found in tuna, mushrooms, fish, and milk.
Okay.
So out of those that I just mentioned throughout your diary that you have given to us, what is something that you would like to change for the next time?
So I would like to change. I want to cut some of those high carb foods out
Okay.
and the high sugar foods and add more of the vegetables and fruits to my
Okay.
diet.
To try and get some of those vitamins in there?
Yeah.
Okay, good. Good. Do you have any questions for me at all?
I don't think so.
Okay. I just wanted to thank you again for coming in today with all your past week's food all written down. You did a great job writing everything down. And if you don't have any more questions, I think that's all I have for you today.
Okay, thank you.
Thank you.